morning, everyone. My name is Obeda. By profession, I'm a registered nurse, certified in emergency nursing. I'm also a consultant for the WHO in the area of emergency and disaster nursing. And I will talk with you a little bit about the emergency medical team, what used to be foreign medical team, to those of you, the old guys. When we're talking about emergency medical team, we're talking about a group of health professionals that provide direct clinical care to population affected by disaster or any other outbreak or any other emergencies, as well as surge capacity to the local authority. It used to be foreign medical team because in the past it was related mostly about foreign people who came from other countries to support the local affected country, but during the last decade it's developed more and more in country themselves, and there are groups of professional teams in every affected country that may provide the care in the event of disaster. What recently developed during the last few years is the concept that good willing is not enough. It's not enough to come and say, I want to help. It's not enough to come and say, there is good attention. We need to have standard. We need to have a way of systematic approach to help the affected country. And principle, standard, quality of care are account, and it should be applied to any kind of disaster, even when we're talking about mega disaster. So when we are talking about emergency medical team, we are talking not only about the clinical performance, but also about administrative, also about standardization of logistics, and also about the initiative of the emergency medical team when it's related to the all human rights that everyone deserves medical care in disaster. It's mostly related to the experience that accumulated since Haiti earthquake, but also in the later stage with the Ebola outbreak, etc., when people realized that there was no standard, that there was cases of different foreign emergency teams that came and created whatever they wanted on field. For example, those who came with no qualification of being a surgeon, but did operation. Those who came to other country with no equipment and rely on the affected country to provide the hospital facility, operating theater, sterilization, when they didn't have any capability to do it. So at the beginning, nobody controlled the situation. Gradually, for example, in the Philippines, after that Tacloban event, those EMTs that came to the country with no capability to provide themselves whatever needed, sent away back by the government. So what's really important is to refer the authority to the local government. And the objective of the EMT initiative, as is today, is to provide mostly training to all those emergency medical teams that involved with disaster, and to provide effective and timely activity and coordination following the disaster, and of course to help the national capability to provide the care as well as the monitoring and feedback to those who provide the medical care, and basically to refer all the authority to the local government, which creates a lot of problems, because if we are dealing with disaster and the government or the local authority are not functioning, who will do it? So this is something to discuss about. It's also combined not only the clinical immediately response, but also the public health response to all hazards that may continue in a further time after the disaster over and after the first response of the disaster, which may take a few weeks only. And in this case, of course, it's important to cooperate and to refer the authority in the legislation to work with other agencies that involve and come to the city. And when we are dealing with EMTs in disaster, we are talking about providing the maximum medical care to maximum amount of people, which again create a problem, because when we are dealing with disaster, we have shortage of equipment, shortage of capabilities, shortage of personnel. So it creates a dilemma. Who will be the one who will be treated if you have limited resources, and where should be treated? And then who will be the one who makes the decision to set the priorities of who will do what? And of course, it's all related to the standards that establish, again, based on the accumulated experience, so the WHO defines the ELTs for different levels, from type 1 to type 3, and each one of these types can provide different or different level of care. For example, type 1 EMT may provide only outpatient clinic to about 100 patients, but they cannot admit patients, they cannot provide any surgical procedure. While the type 2 emergency medical team can provide some admission, about 50 people admission, about 15 operation, but they don't have capability of intensive care and advanced care to those victims that require this, and they have to refer them to another hospital or to another resources. And this type 3 is the best advanced hospital, field hospital that can provide additionally to operation and a vast number of admission beds, also intensive care unit, dialysis, and all that require, including diagnostic tool, PET scan, and whatever. This, going back to what you said, it's related to the same standard that, again, based on the SPHERE standard, that's related to the medical issues. So they work together with other UN agencies in order to create a standard and to follow that its work. The main problem, the way I see it, is that you cannot force anyone to follow the standard. It's all voluntary. So the WHO can come and set the center in the affected country, work with the local government, but the authority and the responsibility is upon the local government. And then if the government don't force or don't decide to declare that they're going to check who is going to enter to the country, who is going to work in the country, who is licensed to be there or not, they may have a problem because still it's a very wide and broken area. So at the end of the day, the responsibility refers to the local government, to the local authority, and the WHO is there mostly to support them.
Thank you. Thank you so much, Odeda. You've raised very important points.